started an OB hospitalist group about 1 year ago here at Wesley. For a long-standing time in Wichita, we've been incorporated with the University of Kansas and been a teaching hospital. As things have evolved, it became apparent that having an OB hospitalist program would really benefit patients as well as our residents and medical students, in addition to helping our community physicians. We're all dedicated to training and teaching, but sometimes time is limited when you have to balance your time between your office, the hospital, and then teaching. The OB hospitalist program has really allowed us to now have a certified OBGYN on staff in present on the labor and delivery unit 24/7. And that has really added a level of safety and efficiency that we've never really had before. In event of an emergency, many times your own physician is a few minutes away, and those few minutes are very critical. So having somebody with experience that can help coordinate efforts to manage the emergency makes a big difference in outcomes and safety measures. I really, I enjoy teaching. It's fun, and now that I'm here on the labor and delivery unit all the time, I don't have the rush of having to just find time to teach. It's a one-on-one every minute of the day. We find little opportunities to talk about things, getting back to seeing patients that come in, not so much in an office setting anymore as I previously was for a long time. I now get to see people are coming into the hospital because there's something that concerns them. So it's a different type of encounter, and a lot of times, if you're coming into the hospital and particularly they're pregnant and they're many times preterm, or there's something that's concerning enough to make them want to come in, anxiety's high, and so it really is helpful to help a patient alleviate those fears. And most of the time it's not anything serious, and we can quickly reassure them that that's the case and they're going to be well taken care of. But on the flip side of that, being there and available to react in an emergency if it arises quickly, and having somebody with lots of experience helps in that situation. And that's what I really enjoy doing that. Starting July 1st, we'll have 5 OB hospitalists that are on staff. So we rotate our schedules and have availability, and we're here 24/7. So there's not a time at all that there's not a certified OBGYN on labor and delivery unit. And that has really made a big difference in helping us hone our our emergency preparedness. We do drills, and previously that had been challenging to try and get drills done because of the time conflicts between everybody involved. So that's been very helpful, and we're really looking forward to moving in a new direction now that we have full-time staffing of that department. So this year has been very interesting with COVID-19 being, a nationwide, world, global issue. It's really brought a whole new dimension to how we have had to change things and care for patients. Interestingly enough, in most areas of the hospital, we had to move to where we had to isolate and restrict people coming to the hospital and only deal with the very critically ill patients. However, in my department, women were pregnant before COVID hit and have continued to have babies throughout this time. So our department really had to make some very special considerations on how to deal with the volume of normal labor and delivery unit, yet add the extra measures to protect patients, newborn babies, and as well as our staff, our nurses and doctors, and all the ancillary staff that we have that need to help to take care of moms and keep everybody safe has brought a whole new dimension to our unit. So we absolutely think the hospital is the safest place to have a baby, particularly in the time of COVID. I know a lot of people have expressed fear. For some of my friends outside the hospital, are fearful of coming to the hospital, but I argue with them and tell them that really the Hospitalist is the safest place to be. Every inch of this hospital has been detailed and converted into a way that we manage everybody coming in and out. And outside of a hospital setting, I don't think it's really possible for most things. So really, in the event that you need medical care, a hospital really is the safest place to be. Now, we've made special preparations because we have had some moms that have been tested positive for COVID and either knew ahead of time before they came in to have their baby, or during the course of labor have developed symptoms that made us concerned, and we've tested for COVID and found out that they're positive. We found it out afterwards in the postpartum period of some moms that developed symptoms that made us concerned about that. So we have made special preparations in how to help moms deal with that. Fortunately, we've not had to deal with too much serious illness in pregnancy, thankfully. Unlike flu in pregnancy, where influenza A and B can really make pregnant women are actually listed as a high-risk patient if they contract influenza A and B. So far, our data that's come through with COVID does not appear that pregnancy enhances the risk for developing serious disease with COVID for the mom or the baby, thankfully. That's not to say that there are some exceptions, but as a general population rule, we don't consider pregnancy a high risk factor for COVID. Part of the several, when we went to isolation in the hospital setting, along with that came of how to try and keep our unit safe for people that weren't infected with COVID versus those that were infected with COVID. So part of that process came with trying to help once a mom delivers and has her baby, that the baby, trying to protect the baby from contracting COVID virus, particularly if mom is positive. So we've really developed some one-on-one teaching of how to deal with a mom that is COVID positive and still wanting to breastfeed her baby, and how she can take extra precautions to protect the baby. We still advocate breastfeeding with that, but there are just some extra steps on how to do that, and our nursing staff has been very well trained and have prepared on how to deal with that individual mom and her baby, and what the circumstances are going to be when she goes home, and how to deal with that. Most importantly, once out of the hospital setting, because we limit contact of who comes in contact with the newborn here. Once we get home, sometimes that's a little challenging with over-eager family who really wants to come and see the new baby. But in this time and age right now, it's really discouraged, and you really need to stay at home as much as possible and take extra precautions with hand washing, protecting the face with a covering. Now, we do strongly discourage any type of covering to not be placed over a baby. Any child under the age of 2 should not have any type of face mask or any type of plastic shield over the face at all. That's not safe for that child. At this point, large population studies aren't able to be done. We're still really sifting through information coming in from various modalities of how to see what problems are coming up. As of right now, it does not feel as if there's an increased risk, like I had said, of developing complications if you were to become ill with COVID while pregnant. We don't know with the early pregnancy, like in first trimester, if somebody contracts COVID, as to whether that increases the chance of miscarriage. That is such a hard thing in such a short amount of time to really figure how to get through that data to see if that's really true or not. I don't really honestly feel like we'll probably have any reliable data on that for several more months until many educational centers have been able to pool data and look at the large populations and see whether miscarriage risk is higher. We, at this point, have not been able to associate any type of birth defects or anomalies in newborn babies that have had a mom exposed. With that, the mom that becomes ill with COVID doesn't appear to have any specific problems related to the pregnancy, meaning her illness can be severe just like a person that is not pregnant, and most of those are respiratory type of complications, and then if it's a more serious illness, there can be kidney and other issues that go on with that, but the pregnancy itself does not alter that course. So we have limited the hospital entry to 2 entry points. So every person, including all of the doctors, nurses, ancillary staff, every visitor, every patient, goes through those dedicated entry points. There's stations that require placement of proper PPE, meaning hand sanitizing, placement of a face mask, and then you're screened with a temperature. It's a no-touch type of screening with that, and if the temperature is under the threshold of what we expect for that, then the people are allowed to go in. If somebody doesn't meet those criteria or can't tolerate the PPE, then we don't allow them to come in at this point. Are we doing? We are moved into testing for, we obviously still can't test just everyone that wants a test, but we've kind of went through strategies on how to utilize our testing that we have available in the most efficient manner. Since we have started to allow elective surgeries and procedures, we are screening anybody that's coming in for a surgical procedure, or if they are scheduled for a C-section or scheduled for an induction of labor, we are screening those moms for COVID. The reason for that is to really help us decide how to manage that patient. Now, with an elective surgery, the surgery can be postponed until the patient is no longer screening positive for COVID, and then that way it minimizes exposure to all the other people that person would come in contact with at the hospital. For pregnancy-related things like a scheduled C-section, we can't really a lot of times postpone that, but having the knowledge of somebody who doesn't have symptoms but would screen positive allows us to help teach that patient, because they're going home with a new baby on, and will have family members around them, about how to deal with that situation so that it can be safe for everybody involved. So it is certainly not meant as a way to segregate or create problems. It's a way to help keep our staff safe. It's a way to help moms and dads going home with new babies and help to protect the baby and other children in the family if they were known to be positive. There can be certain measures that wouldn't be done had they not known about this screening. So birth experience will change. During these times where we've had to limit visitation within the hospital, the birth experience will be a little different as far as attendance by family. Depending on the level of restriction we have, it will determine how many people can be present in the room. And this is a safety feature. It's not meant to be punitive, and we certainly don't like that we have to do that, but we need to do that. So one support person is at this time is what we're limiting. Now, the process of labor and delivery and the ability to do things during the labor won't change with that. So that's hopeful. Now, if a mom is COVID positive and she is in labor, there are extra precautions as far as limiting the number even of our staff that come in contact with them, taking extra preparations and for personal protection for our staff as well as the patient there, and then restrictions on being able to go in and out of the door, because we want to minimize that as much as possible so that we don't expose another person with that. So there are a few changes, but for the most part, we're trying to still keep things as normal as possible and to allow you to have a baby with an experience that will be memorable. So as an OBGYN, it's, you know, the part of that most of us that went into this field just enjoy bringing new life into the world. And I want to reassure people that that is still taking place, and we're still excited to have people come in and help new parents, you know, welcome their babies into this world. So despite all of the drama going on in the world right now, and with the pandemic and all of the other issues, you know, labor and delivery is the happy place in the hospital, and we want it to continue to be the happy place. And we welcome people, and our staff is here ready to make it as enjoyable as we possibly can for you.